I think by now it's a well-known fact that South Africa has the highest reported FASD or fetal alcohol spectrum disorder rates in the world. Globally, the World Health Organization estimates that the global rate is less than 1%. The estimated national rate in South Africa is approximately 11%. However, in some of the areas that we work, the prevalence rate is as high as 28%, or 280 per thousand of the population. There is an area in South Africa where the prevalence rate is 31%, in other words, 310 per 100,000 of the population. I quite often get asked why our rates are so high. There are various reasons. Let's first look at the psychosocial reasons. These high rates we often find in communities that are very poor. There are high unemployment rates and the education level is very low. Now, I think one can then understand that the communities quite often there's a sense of hopelessness in a community. We also know that pregnancies in South Africa are quite often detected at a very, very late stage. So when we talk to women and we ask them, of course, in our very safe environment that we work in our centers and also in a non-judgmental way, if we ask them, why did you drink during pregnancy? They report various reasons. It might range from, I didn't know about the harmful effects of alcohol, or I didn't know about fetal alcohol spectrum disorders, or I didn't know that I was pregnant. It is essential to mention that approximately 78% of pregnancies in South Africa are unplanned. It doesn't mean that these babies are unwanted babies, but it's just that the woman didn't plan the pregnancy. She either didn't use a family planning method, or for whatever reason the method failed, or various reasons. So it might be that the woman doesn't even realize that she's pregnant and she just merely continues to use alcohol during the early weeks of pregnancy and then unintentionally expose her baby to the harmful effects of alcohol. Other reasons mentioned by the woman are things like stress, depression, anxiety. Mental health services, especially in rural areas, are really very poor in South Africa. So many people don't have access to mental health services, so self-medication is really a reality. Sadly, also, some of the things that are reported to us is pressure from the peer group or family members, like the boyfriend or the father of the unborn child, friends and family, etc. So women often find it very hard not to drink during pregnancy, especially in areas where drinking is part of the culture. Another question that I often get asked is, why do we do so many prevalence studies? To date, we've done 19 prevalence studies in South Africa. It is a lot and it's huge studies. Having the stats available enable us to raise the concern about the big problem of FASD in South Africa. It also helps us to lobby for better services. It also gives us a good idea, while we're doing the research, what to do in the community, what the community needs. So after we've done the prevalence studies, we start with what we call our whole of society type of programs. Now, I told you about the peer group pressure and the dangers of that, but also when we sometimes ask women, why did you stop drinking alcohol during pregnancy? They would say things like, my boyfriend, my husband, my partner wanted a healthy child. He wanted a child not born with FASD. So therefore, he supported me not to drink during pregnancy. So we rely on comments like that to get the community to know about FASD, to realize that their input and their support to women of childbearing age is extremely vital in this process, especially in the prevention of more children being born with FASD.